We're still just going to give folks a few minutes to join.
Who knew I was going to get a private tutorial?
I We call it virtual office hours, kind of like if you show up to professor's office hours and you're the only one, you get one-on-one attention. It's a good thing. We did have a couple more registrants, but we'll get started in another minute or two. Avalon, do you want to see if your audio is working now?
Yes, can you hear me?
Yeah. Okay.
Perfect.
Well, hello again. Good afternoon. Have I seen you before at one of these virtual office hours events? I thought so. The one we did on Medicaid. Cool. Well, great to see you again. I hope that we're able to give you the information that you are looking for. Are you interested in the full sort of background overview and demo, or do you have particular questions since you've already seen our demo?
Well, I think it would be useful for me to, since I'm old and I only learn by repetition, it's fine for me to go over, review things. My
Great.
particular interest is um, I'm part of a healthcare coalition for the North Country. So my particular interest is upstate New York, CD21 specifically, and rural healthcare. And so if we have time to get to some of that, I would love to go through it a little bit. Um, but it doesn't have to be exclusive, obviously.
Great. Okay. Well, we've got another person who joined, so we're able to start. We can do the full background and demo. Hi, Susan. Thanks for joining. There's just a couple of us today. So we were just chatting before getting started.
Hi,
Great.
thanks.
Welcome. Thank you. So welcome to our virtual office hours for the Congressional District Health Dashboard. We are going to do a couple of slides with some background information on how the dashboard got started and why, and then we're going to launch into a website demonstration. The session is being recorded so that we can share it with you all later. We also upload it to YouTube as a resource for folks, but and I don't think anyone needs to worry. We usually cut off the Q&A at the end if you have questions. It won't be like public for the world to see. The If you could actually, if you want to introduce yourself, you could put your name and the district that you're interested in, that you work in, represent, live in, anything in the chat. I actually live in Indiana's um, 8th district, so I'm going to put that in the chat. And but I used to be in New York district. Avalon on our team, I think, is a California native, but now New York. But so Avalon, you can put whatever district you'd like to. Okay, so I'm going to go ahead and get started with our demo. And if you put your district in the chat, then I can use it later when we're actually doing the overview of the site. Okay, so welcome. Really, until now, with the Congressional District Health Dashboard, rigorous nonpartisan data on health and conditions that affect health have not been widely available at the congressional district level. Prior to this role, I actually worked in advocacy, and so I can say firsthand that trying to find data at the congressional district level that I needed for health and public health advocacy were really hard to come by, if not impossible. So I was so happy to join this team when we launched the dashboard in 2023. Our goal is to provide granular data at the district level that's straightforward and unbiased to help inform and catalyze priority setting. Data, it is not enough on its own to change policy, but it can reveal insights. It can inform folks who are sort of, not knowing what's going on, and also hold people accountable. Our audiences for the dashboard are really primarily elected officials and their staff, advocates, journalists and researchers, but also the general public, any citizen advocate, person who's interested in understanding more about their community. We try to provide data and tools that will be useful to anyone to be able to access the information they need. Our work at the Congressional District Health Dashboard builds on our experience developing and leading the City Health Dashboard. We launched the City Health Dashboard in 2018, and the idea is similar in providing measures of health and drivers of health that are not available typically at the city level. So I've been talking about what measures and measures of health. This slide shows all of the measures that we have on the dashboard. It's 40 in total. We have them organized across 5 domains that are listed here. Health outcomes, under which you may recognize some really familiar types of health data. Social and economic factors. These are things that are more at the community level that influence individual health outcomes. Health behavior, these are things at the individual level that impact health. Physical environment, we have a few measures there on lead and housing and air quality. And then finally, our clinical care domain, where we have some measures that get into access to healthcare. For some of our data, we have demographic data available. That would be data by sex, age, or race and ethnicity, or some combination of those 3 categories. And then we also have, for almost 30 of our measures, we have census tract level data available. So we know that in some districts, folks are looking at, really needing to zoom in on differences between neighborhoods. So we do provide the census tract level data when we can, and we'll show you that when we get to the website, how to find it. So we do apply a rigorous approach to how we think about what metrics we want to add on the site and what the data sources are for those metrics. We use national data sets so that we can cover the whole country. Most of our data comes from federal sources. We look for rigorous methods underlying the original data collection. So before we even think about adding a measure to the dashboard, we're looking at how is this data collected and how is it analyzed. We also look for measures that reflect public health priorities. So things that people are thinking about and working on in the field. We update our measures regularly, so we look for data sources that also provide those regular updates. Typically, all of our measures get updated once annually, but we have one measure, Medicaid enrollment, which we update more frequently. And then finally, we just went over the domains, so we try to kind of have a balance of measures across those different domains, and in recognition of the fact that there are so many types of factors that influence and drive health. So I am going to transition over to the website demo, but before I do that, I just want to call out our funder and partner, Robert Wood Johnson Foundation, and also 2 other partners that really helped shape the dashboard, the Bipartisan Policy Center and the Center on Budget and Policy Priorities. Great. My colleague Avalon just put the link to the dashboard in the chat if you want to go there on your own, but I am going to navigate to my browser so you all can see that. Just want to confirm that you can. Okay, getting a nod from Avalon. Okay, I just want to take a second to look in the chat at some of the districts that you all put up. I was in the wrong area earlier. So we've got Massachusetts 8th District, Washington 7th, and New York. Well, that's New York 10th and then New York 21. Okay, great. Thank you. All right, so this is our homepage. From the homepage, you can, of course, go anywhere, but we want folks to start out by identifying the district that they're interested in. So we have the opportunity to enter in the district that you know you're in, or to search by address. And you might search by address because you're, looking at a facility or maybe a hospital somewhere, and you want to know, what hospital is represented by what member and that sort of thing. But it's typical, I think, especially in this crowd, that we're going to get folks who already know what district they're interested in. So I'm going to start with Massachusetts 8th District. And this will be a little spelling test for me on whether I can spell Massachusetts or not. There's not a nice little rhyme like for Mississippi. Anyway, okay, Massachusetts 8th, here we go. So when you are starting from the home page, the first thing that's going to happen when you enter in your district is it'll take you to the health snapshots page. And that's kind of our big entry point to the site. This will tell you for any district or state that you've selected what the estimate is for every metric we have on the site for that district. They're organized alphabetically by the metric, but you can also filter by the domains that we mentioned, or just look at measures that you would like to select. I'm going to stay on the big screen just for the moment. So I'm going to just kind of scroll down so you can see we've got lots of information about Massachusetts 8th District to look through. And another thing I want to point out is in this column right here, we're actually giving you with a symbol the information about how this district compares to the US average. So you can already see a mixture of how Massachusetts 8th District is doing compared to the national average. The triangle here means it's around the US average. The square is that it's doing worse than the US average, and then the circle is that it's better than the US average. And there's a little comparison legend over here. Another thing that you can do here is hover over this and it'll actually tell you the number. So if you're just kind of interested in exploring, like, well, how much better or how much worse than the US average, you can see it quickly as you're going through. For those of you who are thinking, okay, great, I want to take this to a meeting that I'm going to next week, or I want to, pull stuff for a presentation, you can go up here and print the page, and I'll give you like a really nice visual printer-friendly view of the health snapshot. Trying to think of other things. This little eye right here will give you a little more information about the year of the data and the data source. So this one is from December 2023, and the source is George Mason University. If you want to know even more, you can click onto this little more about the metric and go to the metric background information for that measure. So similarly, I'm hovering over the eye next to binge drinking, and I'm seeing, the data is from 2022. It's from the Places Project at the CDC. So I think that's almost all for this page. Great question, Christopher, in the chat. How do you pull data for a PowerPoint presentation? I think there are a couple different ways to do that. I can show you as we go through more of the visualizations. What I would probably do on this page is either go up here and print the page to get this print to PDF view. And then I might use screenshots, and that could potentially get you the highest quality visual that's based on this page. As we go through, I can show you the other downloadable images that we provide for folks of the maps and the scale bars that we have on the site. And I think those would typically be what I would suggest more for like a PowerPoint. So still on the health snapshots page, we have two tabs on this page. This was the metrics overview for the district. This is the district facts page. So this page has the total population for the district at the top. Then it has a chart that shows you the population by age, and then the population breakdown by race and ethnicity for the district. This is sort of just basic information about the district that's helpful as you're thinking through the site. The other linkage that we have, I mentioned earlier, our sister site, the City Health Dashboard. This is really useful when you're really working with local governments or with advocates who are saying, hey, we know you represent this whole area, but over here in Braintree Town or in Weymouth Town, we have a really big issue and we want you to know about it. And then you know, working at the congressional district level could click over to our City Health Dashboard site and look at the same measures that we have at the Congressional District Health Dashboard, but at that local city level. It's also nice to be able to see sort of how much of Boston this district represents. You can really see that visually here with the way the city populates in the map. Finally, at the bottom of this page, we have the members of Congress for the district. It's just a good reference if you're maybe more familiar with the member than the district number. Okay, I'm gonna navigate over. My walkthrough is going to include just a brief overview of each one of these parts of the website. So I'm going to navigate over to metric maps next. So I'm going to pick children in poverty, one of the social and economic factors, to demonstrate our metric maps view. So after I select the metric that I'm interested in, this is sort of another main entry point to the website. I can pick them, I can go by the district, or I can go by I'm interested in this issue, or I'm interested in this particular measure. And what comes up, what loads automatically is the national map. From here, I can start to say, I'm interested in, exploring a specific geographic area, or I want to zoom in and see, what's going on. I think we'll stick to Massachusetts for the moment. What's going on in, in a particular geographic area. So you can see, I'm zooming in a little more, that in this district, not Massachusetts 8th, but Massachusetts 7th, it's like a darker color because, and it's standing out compared to the districts around it. So it's kind of a way to like visually see difference in the map view. I'm going to orient us a little bit more on this page. At the top, we have the scale bar for, right now it's for the whole country. If I go ahead and select a district, I'm going to do New York 21. Then it will load for that district, and then the scale bar will also populate here. So Christopher, you were asking about how to use this in a presentation. Down here on the left side, you can download the map image or the scale bar image for your use. And depending on what district you select or state, it'll, those images will update for you and it should accurately download. So across our site, you're going to see similar colors to indicate whether there's a better outcome being indicated or a worse outcome being indicated. In general, the darker colors indicate a worse health outcome, and the lighter colors indicate a better health outcome. So that helps you when you're looking at the scale bars, when you're looking at the maps. It kind of gives you clues as to, what's going on in different areas. You can definitely see on this map, at the level I'm zoomed in on, some variation across neighboring districts and neighboring states. So from this page, some other things that you can do. You could change the district that you're looking in here. So I could say, instead of New York's 21st, maybe I want to look at the state of New York. So that'll give me the overall New York average. And then, I decide I'd actually like to look at one of these particular districts, and I might go ahead and click into it again from the map view. So you can navigate between the map and the finding a district in this lookup tool. You can also change the metric. Say you're looking at children in poverty, and you've found what you want to find there. You could, if you click on change metric, this window will pop up again, and you can select a different metric. You can also change the year of data that you're looking at. For most of these data sources, we have going back to 2020. So even though we launched the tool in 2023, we have slightly older data available. We should have 2024 data updated in March of 2026 when we do our annual update. The other thing you can do, I know I'm on New York's 22nd and not New York's 21st, but you can compare the district that you're interested to either to the US average on the scale bar, or you can switch it to the state value. And that just kind of depends on who you're working with, what level of data you want to see. Maybe it's more relevant to the audience that you're working with, to see it compared to the overall Massachusetts value or the overall New York or Washington state value. I mentioned earlier that we have the census tract level data available. So just going to show you here that under map boundaries, if you select show census tracts, it will show you your census tract level data, and then you can zoom in on your map and click on the census tracts to see the values for those areas. It can get a little clogged here, but just to kind of show you, there's a lot of variation, certainly at the census tract level, that can be masked overall by the district-wide average. So it's a really useful tool when you're working at the neighborhood level or trying to figure out how to direct resources within a district. I'm going to pause and see if there are any other questions. You can feel free to put them in the chat, but just see if there are any questions at this point. So for trends over time, you can identify, I'm going to click off of census tracts. You can identify change over time, primarily by clicking through each of the years. So, and then watching the way the scale bar might change. That will show you, I mean, I have it on New York value now. It might be more interesting to see the US average. This is again for children in poverty, which I may or may not expect to change too much from year to year. We also have some of our data sources are not necessarily good for doing comparisons for change over time, and that has to do with how the data is collected and what that data source recommends. I think for this one, you can do change over time, but recognizing that this is a 5-year estimate, like when I click on, I hover over this little tooltip, it tells me that this data is from 2021 and it's a 5-year estimate. So they have actually combined years of data to give you a more accurate representation of the population. And that is because different people get surveyed when they do these surveys every year, and this helps make sure that there's a like better population sample. It makes the data more reliable. If you go on, say, to the 2023, then you can see when you click on the tooltip that it's still a 5-year estimate. So it's kind of like they're using data, adding a new year of data into a 5-year estimate that moves along a timeline. Other data that you can do some sort of trend over time work with would be certainly Medicaid enrollment, because that is really just enrollment numbers from the state. Data from on mortality would be data that would be okay to look at over time. But yeah, I recommend checking out if you're interested in doing the trend over time work, looking a little bit more into the metric background and seeing what it says about the data source and how it's collected. I think the other thing you can do is download the data, so you don't have to necessarily use the map. You could use an Excel to just look at the numbers all right next to each other. And I'll show you in a couple minutes how to download the data. Susan, I'm seeing your question about where does the Medicaid data come from. I'm going to switch to our Medicaid enrollment data. I'm going to zoom out so you can see the national map view. Oops. This data comes from the Centers for Medicare and Medicaid Services. And so every state reports to CMS what their enrollment numbers are, and that's where we get the data from. So that's why it's available more sort of more up to date regularly. We have the data that we have on the site now is from the first quarter of 2025, so just earlier this year. And then in our next data update that I mentioned that we're doing in March 2026, we'll add the new latest quarters of data to this. So the difference between our data and what you'd find from CMS is that what states submit is monthly data, and then we create a quarterly average from that monthly data. So that's why you see it by quarter on our site. We also use data from the American Community Survey to help inform, really to help validate the CMS data. So when folks are submitting the American Community Survey questionnaire, they answer questions about insurance enrollment. So that helps us validate the enrollment data. Medicaid data does not include ACA enrollees, so does not include the marketplace data. If Medicaid, so in New York State where Medicaid enrollment happens through the same marketplace that other plan enrollment happens through, it would only include the Medicaid portion. Yeah. So Susan, you're saying Medicaid enrollment is known to be underreported in ACS. Exactly. So with concerns about underreporting from ACS, that's why we combined data sources to be able to account for potential underreporting. Question on Medicaid enrollment. To what percent of the federal poverty level? I'm not sure. Can you say more about what you mean by that question?
Different levels of this get called Medicaid, and I can't figure out exactly but there have been iterations that seem to include up to 250% as the basic plan, which is still, I think, Medicaid. Then you get, the basic plan is 200%, excuse me. New York State has the essential plan added on top of that, and treats it as if it's just 250%, the same as the ones below, as far as I can tell. So I don't understand all of this.
So your question is whether something like the essential plan is considered Medicaid? Um, that's a good question. I'm familiar with the essential plan as someone who used to work in public health advocacy in New York State. And it's sort of a uh, not very many states have it. I think it's just Minnesota and New York. So that's something I'll check into and get back to you on if that's okay. It'll help just give more background information on Medicaid enrollment in general and what it captures, and what it doesn't. So are there any other questions before I go on to metrics by demographics? Okay. So under metrics by demographics, this is this is a way really to explore demographic data. I'm going to go to Washington, was it 7th district? Great. So, uh, demographic data are not available for the grayed out metrics. So you can really easily see, I think it's 17 metrics that we have of the 40 that have demographic data available for them. And those are all available to click on. If it's not available to click on, unfortunately, we don't have the demographic data, or it's not really appropriate for that metric to have demographic data for it. So I'm going to do uninsured here because it's an example for which we have all the demographic data categories available. So we are in Washington 7th, and we're looking at the percent of the population that does not have health insurance. We can see that by sex. So it looks like a higher proportion of males compared to females do not have health insurance. We can also look at differences by race and ethnicity at the district level. So we have the district level average at the top, and then the scale bars and the numbers kind of indicate where in comparison to the district average, the demographic subgroup falls. And then finally, we did based on age group enrollment. So you see the lowest uninsurance for the 0 to 18, which makes sense because of CHIP. And then you have other breakdowns by age group. So this can help you think about when you're looking at any of the demographic data, you can see, oh, maybe we have a problem here, that there's a place where we can direct resources, or, oh, look, we're doing really well in this population. What can we do from a policy standpoint or programmatic standpoint to help improve health in specific populations? Are there any other measures that you all want to see demographic data for? I might try cardiovascular disease deaths just to show you another example. Again, this provides the district level at the top, and then the breakdown by female and male for sex, and then the breakdown by race and ethnicity for cardiovascular disease deaths. I think what we've shown so far are primarily percentages. For the mortality data, you're going to see the standard per 100,000 population or 100,000 people. Okay, if there are not any questions on this one, I'll move on to compare districts, which is another way we have of exploring geographic information. You all haven't said it yet, but we'll go to rent burden. And I'm going to start with New York's 21st district. And then I think I'm going to do a funny thing, and I'm going to add Massachusetts 8th and Washington 7th and Indiana 8th, where I am. And we can look at how each of the districts that we're from are doing. I'm going to add you in here, Avalon, New York 10th. Okay, so as you saw, as I was typing these in and pressing enter, boom, 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 we've got a bunch of whole scale bars for each one. So right at the top of the page, we have the national scale bar, and then each district that I typed in has the value and where that is on the scale bar. So we're seeing some slight variation all under the US average, which in this case for rent burden is actually good. We have this lower values have better outcomes. We know lighter colors on the dashboard tend to indicate better outcomes. I'm curious, we can also add in a state. I'm going to add New York State since we've got 2 New Yorkers. And we see a different thing here. We see the statewide average is higher, a little bit higher than the US average, and definitely higher than all of the districts that we entered. So scrolling down, the other feature that this page provides for you is what we call a card on each district, and the card gives you this statement at the top that puts the data in sentence form. So if you're communicating it with others, it can be really useful not to just have, here's a scale bar, here's a map, but also here's a sentence telling you what this is. So each card has a little map, a scale bar, the sentence, as well as the data source and the year of the data source. Similar to the health snapshot, you can print the page. We did, sort of on the back end, set it up that it won't split the cards. So you're able to, use this as you need to. You could take this to a meeting. You could, have a PDF and use screenshots from the PDF there are probably fancier ways of pulling images from PDFs than screenshots that I don't know about, but there are a lot of ways I think you can use these in your work. And similarly to the other page, you can change the metric, you can change the time period. What should populate for every page, what we assume is that most of our users are most interested in the most recent data, so that's what's going to show up here. Finally, we've been talking a lot about metric background and how you get more information on a metric. Every metric has a metric background page. I'm going to go to diabetes as an example. This says our data sources, why we measure it, how we measure it, the strengths and limitations of the measure. And this is really like, Susan, you said earlier, there's known underreporting in ACS for Medicaid enrollment. That would be something we'd acknowledge on this page because we want folks to know, if you're looking at these data, this is how you should, consider it. If it doesn't align with what you know to be true about your community, there may be some reasons in the data as to why that is. We also provide a sort of simplified version of the calculation, the data source, and the years of collection, and then there's some references for our work. So the last thing I wanted to share before we wrap up the demo is I did mention that you can access the data. If you go to this little hamburger menu at the top and you click on access to the data and you've never accessed the data, what will come up is a little survey asking you to tell us, how you plan to use it. And that just helps us give us an idea, as to how people are engaging with the data on the site. It's not used for anything except, helping us understand how this is useful to people. After you fill out that survey, you'll get access to this page where you can see how to cite our data. You can learn more about our data by downloading the data dictionary or the technical document. And then finally, you can, type in metrics that you're interested in downloading the data for. I'm going to select some of the health behaviors ones, binge drinking. Let's see, I can do smoking, um, put in uninsured and Medicaid just to show you how many you can enter. You can enter in as many as you need to here. And then you can select the states that you're interested in. Say I want to do Colorado, um, Tennessee, wherever you are, and then whether to include the data at the state level, the tract level, and the congressional district level. You can also sort of go by the flip way. You can enter by state and then select by metric. So it's just kind of two different ways to get at the same thing, which is what cuts of the data will be useful to you. That is all for our demo. I want to just open up for questions and I'll jump back here so that you can copy these links if you need to. Avalon's going to drop the links in the chat. You can always email us if you have questions at this info@cdhealthdashboard.org email. If you want to stay up to date, we send out a monthly newsletter, no more frequently than monthly. And then we also have a page on LinkedIn that you can connect with and follow to stay up to date as well. We're always really interested in hearing from folks about how you're using the data. Mariana, I see your question. So this is the home page. Anywhere across the screen, you can go to access the data from this menu here. I had to actually click on it, not just hover to get to it. And then my screen is showing this right now, but when you click on it, if it's your first time accessing the data, a little survey will come up that'll ask you who you are and kind of how you're interested in using the data, and you'll have to fill that out before you can get to this screen. Great. Okay. I'm happy to hang out for a couple more minutes if folks have other questions. Otherwise, thank you so much for joining us. You'll get a follow-up email with okay, great. Thanks, Mariana. And thanks,
Thank you very
Susan.
much.
I'm happy to stay on, Christopher, if you want to talk about the rural healthcare, North Country stuff that you're working on, and think I'm happy to talk
Okay.
with you just a little bit.
Yeah. Okay.
So we've been thinking about access to data for folks interested in rural areas. And I know that, the dashboard does provide data for the whole country. So if you're in a rural area, you're able to see. Are there any metrics in particular that you're interested in looking at for New York's 21st district? I know we've talked definitely about Congressional District 21 and Medicaid enrollment, but
Well,
not sure if there were any others.
we've been interested in whether there was a primary care health care professional shortage area. We there's been a lot of data published recently that's trying to cement exactly what HR1 is doing to Medicaid. And so there's a lot of national graphs and maps and things. That's one of the more interesting things about New York State is that, in fact, New York State is better off than most other states in the country. In this respect, there's one small area in the middle of the Adirondacks but it's also very underpopulated. So, but in any case, most of the Adirondacks and North Country is actually not a healthcare shortage area. There's a lot of data. I mean, I'm looking to see what you have, and I'm the rent burden is important. But unfortunately, it's high for the entire country, so it's not even, it's not even, you can't really. I think mental health is a big issue. Dental is a huge issue. I mean, there's all kinds of issues that are in the availability of stuff. And then looking at, do you actually look at where hospitals are in any of this?
Um, we don't have that here. Since I worked in like healthcare and public health advocacy, I thought about, where our healthcare facilities located a lot as I've looked at this, but no, you'd have to um kind of zoom in and know where you
Know where
are.
they are and then find them. Yeah.
Yeah.
Okay. That's fine.
And that I think we've done some work for folks where we might, like create a map that has the, things that you're interested in seeing, um, using our data. But a lot of times people will take the data, through the download page and kind of create their whatever they need to create with it. But that's certainly something um we've thought about. It's helpful
Mm.
to know what folks want to use the data for so that then we can add, ways of interacting with it.
I
Um,
think our concern is just trying to. We're an incredibly urbanized state, which is why
yeah,
the rent burden in New York City is unbelievably high compared to the rest of the state. So of course the state goes above average on that, but um, in any case, it's still um, CD21 includes 15 different parts of 15 different counties, 7 entire counties,
yeah,
and
yeah,
but parts of 8 others. There are. So from our perspective, we're talking about the 10 counties of the North Country because they're all. It's not the same as CD21, but it is. It's still the data is still useful. Um,
right.
uh, No, I don't have a lot of brilliant thoughts. I'll go through in more
Yeah,
detail
that's
all the
okay.
metrics. What?
I said that's okay. I was just curious to see if we could support you. Um,
We're in this weird position where this healthcare coalition is getting asked to give speeches, and we have to prepare talks. And so I'm always looking for data. Just
yeah.
I mean, we're
Have you
supposed to be
used
experts, or not? We're not.
Have you used the Center for Healthcare Workforce Studies work from SUNY Albany? They have good data on New York State healthcare workforce shortages. I think I stopped sharing my screen, and
That's you, Albany.
I think it's
What you call it?
soon.
Unit Center for Healthcare Workforce Studies.
Yeah.
Okay,
Yeah. If I put a
good to
link
know.
in the chat, will you be able to pull it from there?
Um, I don't have a screenager around the house, so I can't. I don't consider myself. I am technologically challenged, as my daughter and my
Yeah.
wife will be happy to tell you. Anyway, but yeah, if you let me just look at, I have no trouble finding these things when I go look them up, so that's not the
Yeah, okay. If you
issue.
search Center for Health Workforce Studies,
I'll find it.
um,
Yeah, that's
you'll
fine.
find it, and it looks like, yeah, it's SUNY Albany.
Okay, that's fine. I'll find that. I mean, that's great.
Um,
That's a great reference. So
Another, since you were speaking at the county level, another resource for you could be the county health, um, what is it, rankings? It's countyhealthrankings.org. This was another RWJF funded project that you might find useful for looking at health data by county. Um,
okay,
I mean, it's
yeah,
really like I understand you're looking for data at a broad level. We have many of the same measures as as county health rankings, but theirs are at the county level, obviously, and ours are at the congressional district
yeah.
level.
Yeah, I mean, I think what you give is very, very helpful on many different levels. I mean, all the congressional district stuff is going to become even more relevant next year. But the um, I thank you for the other references because um, we're really looking at the stuff that's predicting the impact of HR1, and
Yeah.
obviously you're not you're not giving me that. That's fine. I don't care. I need the stuff from the past as well. So it's fine. I mean, it's not. That's why I found you useful in the past. Anyway, thank you. I mean,
Great.
you know, I'll go mess around and see what I can figure out.
Sounds good.
All right.
Thanks so much for joining us. I hope you
Thank
have a
you.
good evening.
Yeah, you too. Thanks very much. Happy Thanksgiving.
Thanks,
Thank
you
you, you
too.
too.